Welcome, I'm Dr. Jamie Wells, and I am part of the inaugural course for Drexel BIOMED's launch of the nation's first of its kind Pediatric Engineering program. And I am so excited because I had the great privilege of being an attending at NYU, and we have our distinguished speaker, Dr. Manno, who is the chair of the department at NYU Langone, and single-handedly, well, mostly from my viewpoint, single-handedly was such an instrumental part of the development of Hassenfeld Children's Hospital at NYU Langone. So when I sent you the invitation to be a distinguished speaker to this innovative program, you didn't hesitate. Why was that?
When Jamie asks, I can't say no. I think it's a very exciting program, and I'm very happy to participate in its inaugural year.
Thank you so much for being here. We're truly touched. The students are in for such a treat. I would love to know, why do you think that the market, previously in medicine and therapeutics and devices, everything is about thinking that children are just little adults, and we know that not to be true. So most of the products in therapeutics and device development have been geared toward adults and then been tailor-made for kids, not the other way around. The pendulum has shifted on that thought process, and the market is growing for this need for pediatric engineering. Why was that so important to you when you were designing Hassenfeld Children's Hospital?
I think we need to focus on the physiologic needs of children, which are very different from those of adults. From a psychosocial perspective, we're always focused on making sure children are cared for in the context of their family. And from a biomedical perspective, we need to downsize things so that we don't modify those things, as you mentioned, that are created for adults only. We need to think of the unique physiology of infants and young children. By the time the kids are 15 or 16, although psychologically they aren't adults, their bodies are much more similar to adults than are neonates and infants and toddlers. So focusing on that younger group of kids is very, very important for their improved health outcomes as well as the ease with which we can treat them.
And my final point is, at the core, you are a clinician, and as a pediatric hematologist oncologist whose special interest is blood disorders, what do you think are the greatest unmet clinical needs, and where is the future of innovation in your field?
I will speak today about blood transfusion, and you'll see some of the areas of need in transfusion medicine, particularly as it relates to children's health. But I also think that there are unmet needs in oncology, despite the fact that outcomes have improved tremendously over the last 50 years. We still have a ways to go, particularly in difficult-to-treat presentations and relapsed disease. On the hematology side, the disease I speak the most about is sickle cell, and there's so many unmet needs in sickle cell disease. Some of us who've practiced for a while don't feel that we've made much in the way of advancement in sickle cell disease, particularly when we compare it to cancer in children.
Thank you so much for traveling from New York City to Philly. She's also a Drexel alum.
I am.
And we are very excited for her distinguished lecture to begin.
Thank you.
Thank you.